If you stuck a fork in a toaster, you'd electrify yourself, right? Well, what if you couldn't feel pain? What would happen? Hey, I'm Mercedes, and today I'm here to talk to you about congenital insensitivity to pain with anhidrosis, aka C.I.P.A, which is the inability to feel pain and burning, but pressure can still be felt.
Hundreds of people around the world suffer from this disability, and honestly, I really don't know how I'd be able to go through a normal day with C.I.P.A.
Talking about all of this has really got me thinking. Would it be a gift not to feel pain, or a curse? Well, good news is that today we'll be getting these questions answered and many more today with our guest, Alex.
Alex is a boy who suffers with C.I.P.A. And matter in fact, he has suffered a severe accident in the past. Alex is going to be telling us how he goes on with his everyday life dealing with C.I.P.A., how it feels to have C.I.P.A., and also he'll be explaining us what happened with this accident. Why, hello, Alex. It's good to finally meet you.
Yes, very glad to meet both of you. So, Alex, let's begin. When did you discover or how did you know you had C.I.P.A? Well, when she put me down in my crib to put me for a nap, and when she returned, she saw that my hands were severely bitten and bruised. She took me to the hospital, and the doctors found out that I had C.I.P.A.
How did she know?
Until I became more mature. Then we went to a doctor to see if there were a cure for C.I.P.A. And sadly, there weren't, although there were many ways to help me live a normal lifestyle while still dealing with C.I.P.A. So then, how did your mother deal with this? Well, there were a few options the doctors gave me, which were to take antibiotics, to have behavioral therapy, to see different educational systems to understand how to live with C.I.P.A, and also to see occupational therapy.
Oh, what did you do to help you live with C.I.P.A., but also, maintain a normal lifestyle?
Well, there were a few options the doctors gave me, which were to take antibiotics, to have behavioral therapy, to see different educational systems to understand how to live with C.I.P.A, and also to see occupational therapy.
Oh, what did you do to help you live with C.I.P.A., but also, maintain a normal lifestyle?
Well, there were a few options the doctors gave me, which were to take antibiotics, to have behavioral therapy, to see different educational systems to understand how to live with C.I.P.A, and also to see occupational therapy. And could you explain to us on how each of these ones are specifically done to help someone with C.I.P.A? Of course. Well, first off, the antibiotics is a treatment where it can be taken in the mouth or applied to the skin to treat the infection. Also, behavior therapy is great to help the younger children deal with C.I.P.A. There are different types of behavioral therapy that can help the younger children improve their social skills, strengthening learning abilities, adaptive behavior. Also, the educational system can be very helpful to children who suffer with C.I.P.A. because they'd be placed in a special program where the parents would get daily information on how their child is doing in school. But also, the school will discuss with the parents on where the child should be placed based on how fast or how slow their learning skills are. Finally, the occupational therapy is quite amazing in my opinion because in each session, the therapist helps the patient perform basic daily tasks such as feeding, dressing, and communication with others.
In my personal opinion, I find the educational system more helpful than the rest because it helps the child learn on his or her level, but also makes the kid feel normal. Because it must be tough to deal with C.I.P.A. at such a young age, but also to understand what they have.
Indeed, I totally agree with you. Although other patients who deal with C.I.P.A. may have a different idea on what they found more helpful. When I went to school, they helped me a lot because I could learn how to speak, write, and do the same things as a normal person. I find all of these solutions are great, but also can help many people who suffer greatly or suffer to a less degree and help them live a normal lifestyle.
Thank you, Alex, for discussing how you deal with C.I.P.A, but also giving us such great detailed information about it.
No problem. Thank you for having me on your podcast. Come back next week for more different case studies to learn about. This is the MJ Podcast, and have a wonderful rest of the week.